This is Dr. Goldwire. Welcome to Lesson 2, the systematic approach to answering drug information questions and tertiary resources. The objectives of the lesson are to describe and demonstrate how to use the systematic approach to answer drug information questions and to write citations using the American Medical Association format. So how do you go about answering a drug information questions? What steps do you follow? Well, there's a systematic approach to answering drug information questions. And this approach has several steps to it. As you can see in this diagram, once you receive a question, the first step is to collect caller information. The second step is to collect patient background information. The third step is to determine the ultimate question and to classify the question, after which you begin searching the data. The fourth step is to develop a search strategy and to systematically search the literature. The fifth step is to evaluate and synthesize the data that you found. And then you are ready to communicate your response. The sixth step is to formulate your response. The seventh is to evaluate your response. And the eighth and final step is to provide your response and follow up with the caller. We will be reviewing each of these steps in depth. So here are some examples. Oftentimes you will need to find out if there is a patient involved or if this is strictly an academic question. For example, if a medical resident asks you on general medicine rounds, what is the dose of methylene blue for drug-induced methemoglobinemia, you would want to know if there's a patient involved. For if there's a patient involved, as you can imagine, there would be time sensitivity, and you would need to get an answer back to this medical resident as soon as possible. The route of administration and formulation. For example, what is the dose of phenytoin? You would need to know what product the physician has in mind, whether he wants to prescribe the suspension, the capsule, the injection, the chewable tablets, because the bioavailability of each of these products is different. Another example is you often need to know concurrent medications, including over-the-counter medications and herbal therapies. Herbal products such as St. John's wort interact with medications. We know that St. John's wort is a P450 CYP1A2, CYP2C9, and 3A4 inhibitor. In addition, it's also suspected to be a P-glycoprotein transporter inducer. So other medications the patient is receiving may interact with St. John's wort. So the first part of the systematic approach is that you receive a question. And when you receive a question about drug therapy, it is important to obtain basic information from the requester. Often, the requester will ask a broad-based question, in which case you need to determine the true or ultimate question you need to answer. So from the requester, you want to collect caller information, patient background information, and determine the ultimate question. You're then going to search the data and communicate the response. So for example, does ranitidine cause neutropenia? If a physician is calling asking this question, it appears that it's a side effect of a medication. Do you think the physician expects a yes or no answer? After all, the physician did ask a closed-ended question. Of course, the physician most likely expects more than a yes or no answer. What if the physician's patient is receiving ranitidine and is experiencing neutropenia? Would this change your answer? Whether or not the question is purely theoretical, that is, no patient is involved, will change the urgency of your answer. What is the recommended treatment of neutropenia? The information you provide, how do you treat neutropenia, and your follow-up. Is this a medication error that you need to report? So again, you need to collect caller information to help you determine what the true and ultimate question is. Another example is, how does ambrisentan work? So if you receive this question from a physician, I don't think the physician would use these words. A physician most likely would not ask you how ambrisentan works, but the mechanism of action of ambrisentan. A physician would ask again for the mechanism, and you would not want to say to a patient that ambrisentan is a selective endothelin-1 type A receptor antagonist and vasodilator. It is an orphan drug approved to treat patients with pulmonary arterial hypertension. Instead, to a patient, you might say, ambrisentan is a new drug approved for the relaxation of one of the vessels that provides oxygen to the lungs. So again, you need to be able to communicate your answer to the appropriate level to whether or not it's a physician or a patient. Now, I did want to take a little side trip to talk about drug pronunciation. As pharmacists, we are looked up to as the drug experts, so we need to make sure that we understand how to pronounce drug names. One of the best sources to use to hear the pronunciation of a drug is Lexicomp. So let's go visit Lexicomp. So I may just show you this real quickly. So again, Lexicomp is available to pharmacy students only, so make sure you bookmark the URL. You just type in the drug name into the search field. And then under pronunciation in the drug monograph, there's a blue button with an arrow. If you click on this button, you will hear the pronunciation of the drug name.
Ambrisentan.
Ambrisentan. So again, when you have a caller who calls you with a drug information question, you need to get from that caller their name, their contact information, and you need to get their title, position, place of work, or anything that will provide you a bit of their background, whether or not it's a patient who has some healthcare experience or it's someone in the hospital calling, whether it's a nurse or a physician. You also need to get the time and the date of the request, when the answer is needed, and of course you want to document your name, date, and time. After you collect caller information, you need to collect patient information. And collecting appropriate background information for the patient is one of the most important steps in the systematic approach. Without all the necessary information to adequately answer the question, you will find yourself calling back the requester to ask more questions. Moreover, the requester may ask you more questions when you call back. The most effective method for getting all the necessary background information is by conversing with the caller. You want to ask open-ended questions whenever possible. But direct questions are necessary to help you determine the true or ultimate question. This conversation will aid you in determining what question the requester truly wants answered. So some of the information you will need is identifying information for the patient, such as name, identification number, and location, demographics, age, weight, gender, race, medical history, such as diagnosis, comorbidities, allergies, medications and dosage, and pertinent lab values. And these will differ according to what information you need to answer that question. And again, how to collect this information? It is best if you can develop a conversation with the requester. You can use closed-ended questions. Closed-ended questions are those that can be answered by a yes or no. Open-ended questions are those questions in which the requester needs to explain. So for example, if a physician called and asked you, what is the recommended dosage of gabapentin? A closed-ended question would be, do you have a patient you are hoping to treat with gabapentin? This is a question in which the requester would answer yes or no. It would be better to ask an open-ended question, such as, would you describe the patient you would like to use gabapentin for? When collecting such information, you may discover there is no patient involved, and in such cases, there is no need to ask for any patient-specific information. Again, other information you will need is based upon the request. So here are some examples of background questions specific to the request. For example, if a caller asks about an adverse drug reaction, you should be asking that caller, is there a patient whom you believe is experiencing this adverse reaction? In the example, does ranitidine cause neutropenia? We want to know if there's a patient that physician has who is experiencing neutropenia and happens to be on ranitidine. And if a patient is involved, we want to continue asking patient-specific questions. You'll need to determine the name of the medication, the route of administration, the administration technique, and dosage of the suspected drug. You need to determine the timing and the dose to development of the ADR. You need a description of the ADR, including symptoms and severity. You need to know if there was any cessation of the symptoms after the drug was stopped, and if the patient ever had a history of a similar reaction with other medications. Don't forget about, if you do have an ADR question that you're answering, to go ahead and report it through your hospital or your institution's medication safety board and initiatives. You may get a question about dosing and administration, and again, you need to find out if there's a patient involved. So is there a patient that the physician wishes to treat? And if there is a patient, you need to find out the preferred route of administration. If this is pertinent, if the drug only comes in one route, you don't need to ask this question. If the patient is NPO or intubated, you don't need to ask if the physician wants an oral form. You may need to know renal and liver function status and other pertinent lab values. You may also need to ask about the choice of drug to treat the condition if you are uncertain that that is the best choice of drug for the condition. For drug interactions, you need to clarify the type of interaction, whether it's a drug-drug interaction, drug-herb interaction, drug-lab interaction, drug-food interaction. You need to find out if there is a patient experiencing an adverse event from a drug-drug interaction. And if there is a patient involved, you want to find out the medications, the route of administration technique and dosages, the timing of the dose, when was the last dose given, the symptoms, and did the symptoms resolve once the drug was stopped. And you want to be sure to offer an alternative therapy. Again, this list is not all comprehensive. And I do have more detailed information on the course page under the Lesson 2. Then you want to determine the ultimate question. While you are having a conversation with the requester, it is important to uncover why the question is being asked. The best example of this is a requester asking about an untoward effect of a drug. You should ask if there is a patient who is experiencing this effect, since you may need to know more in depth about the patient's situation. Additionally, the requester may also need the answer in a timely fashion. The original question the requester asks may or may not be the question that you need to answer. So here is an example. A nurse calls you and says, "I have a patient that's going for an appendectomy. The physician wrote for cefoxitin, 1 gram, IV piggyback 30 minutes prior to surgery. However, this patient is allergic to penicillin and Keflex. Is it okay if cephalexin is given?" There are several background questions you need to ask in order to fully understand what information the requester truly needs answered. For example, what happens when the patient takes penicillin and Keflex? And the nurse tells you she swells up. You continue to ask, do you know the circumstances surrounding the penicillin allergy? And the nurse tells you she was placed on Pen G for Group B strep prophylaxis and began to swell and have trouble breathing. It was stopped and her symptoms abated. She was started on erythromycin instead. You ask about the Keflex, and you find out that she was on Keflex for strep throat. After only 1 dose in the clinic, she began to swell up. The nurse administered epinephrine and she got better. You continue to ask about the patient and find out that she's healthy, her renal function is normal, she weighs 130 pounds, and she's not allergic to any other medications, but she is allergic to peanuts. When you ask about what happens when she eats peanuts, the nurse tells you she swells up and she carries an EpiPen. Before we classify the question, we want to recap what we've learned from the nurse. We know that during this conversation, we learned some important facts. We learned that the patient swells up when given penicillin and Keflex. We also learned that she's allergic to peanuts and carries an EpiPen. In addition, she is otherwise healthy with normal renal function. All of this information is helpful in answering the question. This information tells you she is sensitive to penicillins and first-generation cephalosporins and reacts strong enough to carry a dose of epinephrine to peanuts. The true question is not only is it okay to give cefoxitin, but also is there a better choice than cefoxitin in a patient who is truly allergic to penicillin and Keflex. Our next step in the systematic approach is to classify the question. Once you determine the true question to be answered, you need to classify the question. There are resources to use when beginning your search. Classifying the question helps you determine where to look for an answer. You should begin your search with tertiary resources, followed by secondary and lastly primary. Once the question is classified, you have a better idea of what resource to use. So when you classify the question, this provides you the section in the monograph to which you should consult. Examples of types of questions are adverse drug reactions, questions availability, questions about drug interactions, identification, IV compatibility, pharmacology, pregnancy, and unlabeled use. So again, classifying the question helps you to go to that section in the drug monograph to consult for your answer. After you classify the question, you should develop and a search strategy. The goal of answering a drug information question is to provide an accurate and complete answer while using your time wisely. To accomplish this, you need to come up with a search strategy. Your search strategy begins with classifying the question. After classifying the question, you need to make sure you understand all questions you need to answer in order to provide an accurate and complete answer to the requester. From the conversation, you need to find out, is it safe to administer cefoxitin to a patient truly allergic to penicillin and Keflex? If you do not know anything about drug hypersensitivity, you'll need to research this topic. What is drug hypersensitivity and how is it classified? What type does this patient exhibit? If not, what is the recommended drug and dosage for antibiotic prophylaxis prior to a GU surgery? Lastly, you need to anticipate other questions the requester may ask once you provide your answer. Other questions the requester may ask include, are there any special precautions with administration? Or should this patient avoid all types of cephalosporins? In our example, is cefoxitin safe to use in a patient allergic to cephalosporin? We would want to consult the tertiary literature first. So we could consult Facts and Comparisons, Lexicomp, or Micromedics. For a quick and basic answer, you can use any of these databases. So if we just went to Lexicomp and typed in cefoxitin and hit enter, and pull up the cefoxitin monograph, how we classify this question is where we would look in the monograph. We can classify this question as an adverse drug reaction. So we may find information under warnings and precautions or under adverse reactions. So if we click on warnings and precautions, we see here a warning about hypersensitivity. Used with caution in persons with a history of penicillin allergy, especially IgE-mediated hypersensitivity reactions, anaphylaxis, angioedema, urticaria. And then if we click on allergy, adverse reactions, we see more information. And we see under allergy and idiosyncratic reactions, a hyperlink to cephalosporin allergy. So if we click on this hyperlink, we see associated drugs with cephalosporin allergy. And we can see the first generation, second generation, third generation cephalosporins listed here. And we see cefoxitin. From this reading, we can conclude that this patient has a type 1 allergy that can manifest as angioedema, hypotension, and/or shortness of breath. It's probably not a good idea to give her any penicillins or first-generation cephalosporins. If we continue reading, we will find information on the cross-reactivity with other groups, other cephalosporins, beta-lactams, and penicillins. So again, under cross-sensitivity section, you will find that cefoxitin is cross-sensitive with some allergies to penicillins. So, if we've decided that we want to find out more information on antimicrobial prophylaxis during surgery, we should try to find an alternative for this patient. So what we can do is, since we're in Lexicon, we can type in antibiotic prophylaxis. And you see right now I only get patient education information up. However, if I limit my search to all text and then type in antibiotic prophylaxis, I get more information up. And one of the summary documents I get up is the prevention of wound infections and sepsis in adult surgical patients. Prevention of infective endocarditis. So I'm going to click on this prevention of wound infection and sepsis in adult surgical patients. And you can see that it's organized by nature of operation, likely pathogens, recommended drugs, and adult dosage. So I want to look for appendectomies. So again, I suggest you use your find feature, Control F or Command F. Type in APPEN, and it will take you right to the place in the document where appendectomy appears. And we see that for an appendectomy, non-perforated, enterogram-negative bacilli, anaerobes, enterococci. The recommended therapy cefoxitin, cefotetan, cefazolin, plus metronidazole. We also notice that there is a little subscript 5 and 3 to 5. So let's take a look and see what those say. So we come to the bottom of the chart and we see number 3 and then number 5. So number 5 says, for patients allergic to penicillins and or cephalosporins, consult specific guidelines for alternative recommendations. And we see number 3 is more about a recommendation for persons weighing over 120 kilograms, which is not applicable in our case. So I want to consult the specific guidelines. Again, this is from superscript number 5. So what I would do is go down to the references and take a look and see if they reference the guidelines. And what I do see is that reference to Bratzler, Clinical Practice Guidelines for Antimicrobial Prophylaxis and Surgery. And I also see that there's a hyperlink here. And it's a PDF, meaning it should pop up when I click on it. So if I click on this hyperlink, it brings me to the Clinical Practice Guidelines. And we can see that these guidelines were developed jointly by the American Society of Health System Pharmacists and the Infectious Disease Society of America, along with the Surgical Infectious Society and the Society for Healthcare Epidemiology of America. And again, if I use my Control F and I type in appendectomy again, or APPEN, I can see here, again, it's sideways now, but appendectomy for uncomplicated appendicitis. The recommended therapy is cefoxitin, cefotetan, or cefazolin plus metronidazole, which we saw in Lexicomp. But here is your alternative in patients with a beta-lactam allergy. Clindamycin plus an aminoglycoside, or aztreonam plus a fluoroquinolone, or metronidazole plus an aminoglycoside, or fluoroquinolone. So now we have our alternatives. If we decide that we're going to give this patient clindamycin plus an aminoglycoside, we can go to the clindamycin monograph. So instead of lexicomp, let's just use facts and comparison. And I bookmarked my facts and comparisons right here. So let's go to facts and comparisons and type in clindamycin. And what I'm looking for is an indication, and administration and dosage, because I know that I want to use this for surgical prophylaxis for an appendectomy. But I'm having trouble, right? This does not look right. Bacterial vaginosis. And then, of course, I'm under intravaginal. I need to click on the tab for the injection. So once I click on that tab for injection, that information will be more pertinent. So again, I went to the administration and dosage section because I'm looking for a dose of clindamycin for surgical prophylaxis for an appendectomy. And here I see an FDA-approved uses: severe infections caused by susceptible anaerobic bacteria, more severe infections, and life-threatening infections. And none of those seem to be appropriate. So if I keep tabbing down, I take a look and I find surgical prophylaxis. It says it's off-label. That means the FDA hasn't approved this indication or dose. But it says it's 900 milligrams IV administered 1 hour prior to the incision. And I can click the hyperlink here for the full monograph. So again, this off-label drug use monograph tells me that it's the indication of surgical prophylaxis, and the evidence is from guidelines, so it's recommended in a guideline for use. And the dosage is 900 milligrams intravenously administered 1 hour prior to incision, and redosing every 6 hours if needed. And again, it's the same guidelines that we had already seen from the American Society of Health System Pharmacists, the Infectious Disease Society of America, and the Surgical Infectious Society and Society for Healthcare Epidemiology of America. So we could do the same way by searching gentamicin. So we found our dose for clindamycin. Now we want to look up gentamicin, the most common aminoglycoside. So again, let's watch our tabs because I fell into that in the last example. But this is ophthalmic. We don't want ophthalmic. We want the injection. So we click on the injection tab. We go under administration and dosage. For infections, serious infections, life-threatening infections. And then we see some off-label dosing: cystic fibrosis, once daily dosing, pelvic inflammatory disease. Oh, and here we go. Surgical prophylaxis. 5 milligrams per kilo IV is a single dose. 1 hour prior to incision. Dose is based on actual body weight. If actual body weight is more than 20% above ideal, the dose can be determined with the following equation. So again, we can click on the hyperlink, and it tells us that the data is from a guideline again, and it gives us the dose, 5 milligrams per kilo. So now we know our dose of gentamicin and clindamycin to recommend for our patient who's allergic to penicillins and the physician wrote for cefoxitin prior to her appendectomy. So now we need to synthesize and evaluate our data. We want to consider our resources used and if they're appropriate. From our data, we found the recommended alternatives to cefoxitin through looking in lexicomp and facts and comparisons, and our source was a guideline recommended by the American Health Systems Pharmacist and also the Infectious Disease Society of America. That's a very appropriate source. Google is not an appropriate source, nor is Wikipedia. I do not want to see Wikipedia as anybody's reference in any of their drug information questions. Wikipedia can be edited by anybody. The data does not have to be verified. Now, I do use Wikipedia to locate sources. I will look at their references they used in writing whatever information I'm looking up, but I will not cite Wikipedia. Nearing the end here, we want to formulate our response. We want to consider our requester's background. Evaluating and synthesizing the data is the most important step along with collecting appropriate background information. And when we evaluate and synthesize the data, our conclusions may have an impact on patient care. You may find that you forgot to ask an important piece of information. For example, in ours, if we forgot to ask the patient's renal function and we had a dose gentamicin, we would have to call back and ask for the patient's renal function. So when we communicate our response, we want to consider the requester's background. We also need to consider whether we're going to respond in writing or verbally. When we respond in writing, this provides a documentation of our answer, and it's required when working in a drug information center. You will need to check at your rotation site if a written response to a drug information question is needed. In the notes, I have left you with much more information on how to write up a drug information question. Documentation in writing protects you if the requester tries to discredit or alter your response. Written documentation is essential for reducing liability and also for promoting your worth. Verbal responses are often preferred because this is the quickest way to communicate an answer. Have your notes ready and books or computer open, just in case the caller asks you more questions. Verbal responses do not hold as much weight with regard to legal ramification. And whether or not you respond verbally or in writing, you should always prepare an accurate and concise response that includes a conclusion, introduction, and summary of information found along with the references. My preferred way in writing is to write in an inverted pyramid style, but there's also an abstract style. Most of you are probably familiar with the abstract style, which follows an introduction, methods, results, and conclusion. The introduction provides you important background information. For example, the introduction should include a statement regarding the indication of antibiotics for surgical prophylaxis in our example. It helps to fill in why this information is important and what data already exist. So a good example of an introduction for our drug information question would be, surgical prophylaxis with IV antibiotics is common in medical practice and for a patient undergoing appendectomy. Gram-negative and anaerobic coverage is needed. In an abstract style, we also provide information on patients, interventions, and main outcome measures. You will be going over more of this in your literature critique portion coming up later this semester. In addition, you go into results. You look at the primary outcome and secondary outcome. And your conclusions. You provide only conclusions supported by data. You do not simply restate what authors conclude. You need to critique the data and come up with your own conclusion. I prefer to write in the inverted pyramid style, in which you start with your conclusion. So in our example, the inverted pyramid style, I would start with the conclusion. And an applicable conclusion would be clindamycin plus gentamicin are recommended for cephalosporin allergic patients who require antibiotic prophylaxis for appendectomy. An introduction should include some background information and any other additional information that may be helpful. So an applicable introduction could be surgical prophylaxis with IV antibiotics is common in medical practice, and for a patient undergoing an appendectomy, gram-negative and anaerobic coverage is needed. Summary of the information would include important data that you found. So an example would be, since this patient is allergic to cefoxitin, which is the first choice of antibiotic prophylaxis for an appendectomy, a reasonable alternative would be clindamycin plus gentamicin. The recommended dosage is clindamycin 900 milligrams IV over 10 to 60 minutes, do not exceed 30 milligrams per minute every 3 to 6 hours, and gentamicin 5 milligrams per kilo IV over 30 to 60 minutes, 1 hour prior to incision. Redosing should be based upon serum drug levels with discontinuation within 24 hours post-operation. Lastly, you should always have your references ready. And in writing, you would provide these, but verbally, you need to have them ready just in case the caller wants to know where you got your information from. And again, in the pharmacy world, we use the AMA, American Medical Association style. And I've left an example of these in these notes, which will be online, under Appendix C. So after you communicate your response, you want to evaluate your response. Does your response answer the caller's question? It is so important. I can't tell you how many times I get responses from students that don't answer the original question asked by the caller. So be sure to double check and make sure that your answer actually answers what the question the caller asked. Is the information you provided applicable to the clinical situation? Did you communicate clearly with the caller whether the response was written or oral? And if written, did you use correct grammar, syntax, punctuation, and spelling? And the last step is to provide your response to the caller and also to follow up with the caller. It's important that you base your answer on facts and not speculation. The other thing that's very important in your answer is we want data. Again, we want to base our answer on facts. Always try to answer the question. Make sure the response is given in a logical sequence and that important concepts are stressed. In our example, you would not want to discuss oral dosing of clindamycin, as this is not pertinent to a surgical patient who is NPO for surgery. You also would not want to discuss gram-positive coverage, as this is not relevant to the situation. Try your best to contact the requester within the time frame established. And lastly, verify with the caller whether or not the information was helpful, and if it was not, start over with determining what the true question is to be answered.